All right, now I'm joined with Michael Pearson. And Michael, you represent NOAA, but I always mess up what that actually stands for. So why don't you tell us your title and what exactly is NOAA?
Wonderful. Thank you. My name is Michael Pearson. Like you had mentioned, I'm the Director of Marketing and Engagement for NOAA, which stands for Neighborhood Outreach Access to Health. It is a mouthful. That's why we're just known as NOAA. We are a federally qualified health center, and we have 9 locations throughout the valley, but we actually started as a program right in Scottsdale. So we started in 1997 as a program through Scottsdale Healthcare, a hospital system. But the program evolved. It actually started as a nurse practitioner that was going from school to school, starting at Mojave and Coronado High School, as part of a way to really make sure that our pediatric population was being taken care of. That evolved, and we ended up having a couple of sites, including one at the Paiute Community Center, as well as a few others. And in 2012, we made actually 2011, we made a big decision to become our own federally qualified health center, which meant we were breaking away as a program from the hospital system. So while we are affiliated with now known as Honor Health, we are actually our own 501c3 entity. We are the only federally qualified health center in Scottsdale, and we provide many services under one roof. One of what it means to be a federally qualified health center is that we provide care for everyone, regardless of financial or insurance status. So we see everybody, especially on the medical side. We have family medicine docs, pediatricians, geriatricians, internal medicine. But beyond that, we also offer dental services, behavioral health, psych, nutrition services. What makes it wonderful is we provide these services to families and those that might not necessarily have that coverage otherwise. They can come in, see a provider. Also, if they have any problems with their teeth or mouth, we can even have a dentist look at them. Our well child checks are phenomenal because when a child comes into our offices, we can actually have a dentist, usually right on site, a pediatric dentist that can actually also do the screening, the oral screenings that are usually not included as part of a regular well child check because those services aren't offered in one area. We have grown quite a bit while. I've been with NOAA for now 5 years. I'm really excited that we've been able to be moving into our community. And when I joined 5 years ago, we had 5 clinics. We had just our 5th. We now have 9.
Wow.
And so we are continually adding services. And during the pandemic, we actually launched psychiatric services, which was one of those things that was a year-long dream that hit right in March of 2020. So that got pushed a little bit, but we still were able to launch it in the middle of a pandemic. These services have been tremendous because we've had integrative counseling to help with families, but psychiatric services during the pandemic, there's so much that we've been able to accomplish that we've seen our psychiatric team just grow and grow. We started with 6 practitioners, and by the end of this year, we should have 41 in psychiatric. So that kind of gives you a perspective of how much need there is in the community for these services. We're really still excited that we get to be part of, speaking of, Scottsdale Community Partners and everything that they're doing within the Scottsdale community. The 5 years that I've been with NOAA, we have always got to participate in the back to school event with partnership with the city of Scottsdale and Scottsdale Community Partners. And we are excited to do it again this year. Now one of the things that we always were able to bring was our dentist, our pediatric dentist, directly to the event, and we were able to actually do oral screenings, dental and health, basically screenings, but also education, and give the kids some some types of materials for how to brush, when to brush, tracking all of that, and of course, toothbrush, toothpaste, floss, all that goodness that they can put into their backpacks as well. We started off really just doing those screenings, and we evolved our program to really help. And we created a back to school that was a couple of days later, where they could actually come back into our clinic and get vaccines as well, because we can't necessarily do vaccines on site at the program, but we want to make sure that they're prepared and ready to come back to school. And so we had an evolution, just like Scottsdale Community Partners getting more and more kids. We saw that same growth to the point where we were providing free vaccines to over 200 kids the following Saturday from the Wednesday event every year. This year, we still can't do actual screenings for oral screenings, rightly so. We're still being safe about that, but we are able to provide that dental education, have a hygienist and dental staff on location to be able to provide any education or tips or anything, any questions that they that this population might need or have, and families specifically. So it's really neat. We also can schedule any kids that need to come in for any additional problems right away. We had openings at our clinic that's right in Old Town Scottsdale.
You know what I love so much about your organization is just that when I talk about the back to school event, what I love is I say, no, it's not just equipping them for the first day of school. We literally are taking care of that child and that family in like everything they need with their health. You hitting center on that, their health, their teeth, their, any problems there, because if something's going wrong with somebody, it's kind of hard to start school. You need to be healthy and happy. So I love it. And thank you for explaining so much more of your organization than I knew to begin with.
You can see I'm very passionate about some of the work we do in community health, and I'm really passionate about Scottsdale. I was born and raised in Scottsdale, native, and I love the fact that this organization exists within our city limits to be able to provide the care to everybody, and that's really important to me. I actually tell a story that still sticks with me. My second back to school event that I worked a few years ago, I got to meet a really neat family who we've seen now multiple times come back. So that's really neat in their progression. But the story I actually share with a lot of community groups because of the impact we've able to make with it. I had a family that was coming through, and there was a 3 siblings, and I out of the corner of my eye, I was walking by, I saw the mom say something, oh, there's some screenings over there for dental, I want you to go. And the middle child was actually the biggest, because the oldest boy was had some developmental disabilities, and you could see he was taking the lead, and he had his younger sister with them as well, that I believe at the time was in kindergarten, coming to school as well. And he got everybody over, and we also have a partnership. We provide the continuity clinic for the pediatric dentists from NYU. 8 of them come and work out of our clinics as part of their residency, because pediatric dentists actually have to do a residency as part of being called pediatric dentists. So we actually had a lot of pediatric dentists there that day. We had 6 of them, and so they were doing their thing because they love kids, and this was working out really great. And so they connected really well with the eldest sibling, and he goofed around, and he liked it, and they checked him out. And then they had the youngest daughter come over and give a quick oral screening. But when we asked Gerson, who is the middle child, to do the screening, he just looked at us and said no. He's like, I'm not doing it. And we were like, oh, okay, not pressuring him or anything. And So they went on to the next thing. And at the time, I believe we were next to like the socks, you know, how we have set things. And he had walked on over and they were kind of doing their shopping, you know, it was great. And the mom just kept looking at me and I could tell that she was really concerned and worried. And so she kind of walks towards me and I walk over and I said, is there something we can help you with? And she says, I'm really worried about my son. I think there's something wrong with his teeth. He hasn't been eating. And so I had my pediatric dentist, not the residents, but our dentist, and who is incredible with kids, comes over and says, convinces them, can I just look? I know you're. So they sat him down, looked at him, and what they saw as soon as he opened his mouth, that he basically had all white. It was all one tooth, in a sense. What it was something called snow. It was a tartar buildup that was so bad that all it was tartar across all of his teeth. You couldn't even see any individual teeth. And it was pushing into his gums because it was so heavy and bad that he couldn't chew anymore. So our team jumped into action. We had some eligibility right there on site. They had no dental insurance, nothing. We got him in the very next morning to see pediatric dentist. It took about 3 hours. And we all showed up there. The entire family was there. They took all the snow or the tartar buildup off. Amazingly, he had 0 cavities, none. And he gets in front of me, and I was there to kind of meet him because we really had bonded with the family being there, trying to get them worked in. And I said, how are you feeling, Pearson? He goes, amazing. Now I can smile. I'm ready to go back to school.
Oh my gosh, that brings tears to my eyes. And you know what? I think I remember that event happening because I remember how excited the entire staff, all the volunteers that you guys had with Noah, you guys were so lifted up from that. You guys all had kind of that natural high of wow, this is a good one. And that really just brings tears to my eyes. And I'm so glad that you guys were able to be there and help out with this. I mean, this family that just needed it. That's amazing.
And it's amazing. They still see us. The family does. We got to see them the next back to school event and catch up with them. And it was really great. So it was a little disappointing not being able to do that last year, being able to see them. But we all know we were being safe and we're still being safe to this. So we're excited to kind of get back at it and really do even more with the community. So it's stories like that that really make it such rewarding work that we all do. And even seeing, not even on the medical side, but seeing the joy that these kids get when they have that backpack, and seeing the joy that they get when they get to feel like they're shopping and doing their own things and have some decisions in what they're doing. And honestly, without organizations like yours and the ability to have all of this put into one area, this wouldn't happen for them. This is something that they get to look forward to, that it gives them a little bit of control in their life and provides them with the comfort that they are going to school with a new backpack and they're going to school with new shoes. I mean, when Skechers is there partnering up and giving them brand new Skechers, I mean, that's amazing that we're able to provide that feeling of getting that tangible stuff that we sometimes take for granted to be able to do. So there's some pretty neat stories that really come through it, and the faces of those kids coming out of there they're ready to go back to school.
I was just talking about that with Sue O, and about how you see, even when it's hot, even when we've had it and it's been miserably hot, but it's so funny because at the end of the event, the kids are smiling, the parents are smiling, everyone's carrying stuff, they're all loaded down with all sorts of stuff, and they're just so happy that they got to be a part of this event. Yeah, I love it. And it's thanks to your organizations, thanks to all the organizations that we all come together for the common good. And that is to get these kids that truly need it started on the right foot, because that's huge. That makes a huge difference for their year. Well, we just appreciate everything that you do, Michael, and thank you. Thank you for joining us, and thank you for all your continued efforts. And you know, that mental health piece that you were talking about, I think you guys started it at the exact right time, the needed time for sure. And just wish you guys all the best. And I can't wait till we're all back together again and seeing those smiley faces again, right?
Yep, and I'm going to be there on the 21st, so I probably will run into you again, so we can actually get together and have just at least a hello again, right?
Exactly. Exactly. Well, thank you so much for your time and all the effort that Noah puts into this event. It is so appreciated, and it just that story will stay with me forever. Thank you.